I'm going to start asking some questions, and feel free to panelists, if there are specific questions that a single person has, feel free to answer those directly to that person, or share it with the audience as well. And one of the questions I'm seeing here is, Dr. Schonberg, you can stop the presentation whenever you're ready.
I will do that.
And is the gut microbiome testing, etc., available in India? That's one of the questions from the audience.
I don't know which lab specifically I would recommend, but there are labs that do it. If you would like, I can research a few and we can send that out afterwards as a comment on our website, just so that there's a good recommendations. I know that there are labs that the GI map takes international samples, so but you have to pay for postage. And there are a couple of really good labs in Australia that also do international packaging as well. But I hate to give a recommendation without properly vetting it first. So we can post that.
Yeah, thank you. And the next question is, does the gut microbiome vary from person to person by birth, age, season, or race?
All of the above. And really, you can make a fingerprint based on any one of those things. So if someone is where they're born, geography-wise, how old they are, there's a good amount of data now available that we can model someone. It is almost like a fingerprint to the individual. And as we get better and better with these analysis, we'll probably be able to identify individuals based on this as well.
Wow, that's impressive. The next question is, do processed Western foods destroy gut biome? Is Indian gut biome they were born with good for their health? And if so, what can Indians in the Western world restore? How can the Indians in the Western world restore their biome?
Yes, the processed foods do alter your gut biome, and in some ways for the worse, and actually make it more easier for us to gain weight. The traditional sort of village diet is likely superior because that's something that we have evolved over time to live with. But the traditional Indian diet that's in the city, it mimics much of what the American diet is now. And this is why we're seeing such rampant increases in obesity, diabetes, blood pressure, heart disease in India and in Pakistan and Bangladesh, because our genes are much more susceptible to these disorders with these insults.
Yeah, totally. I was in India, and my employees were so crazy about KFC and pizzas and all of that. They're youngsters. It's harder for them to understand even when we teach. So hopefully, this education will help them. So there's a question from a particular person, but I think this question would be applicable to many people. So I'll ask this. I'm someone who catches cold regularly, and I have a tendency to sweat a lot. What preventative measures can I take to fight my colds?
From an immunologist standpoint, up to 5 colds a year is deemed to be a normal number. It's a little higher than most, but if you're seeing more than that, then probably seek your doctor's attention. There's no medicine or treatment that has ever been effective in terms of prevention of colds. And so living your best healthy life, healthy weight, exercising is probably your best advice.
I think that also applies to some of the COVID things. So thank you for that. Dr. Schonberg, this question is for you. How many times do you recommend gargling per day?
I usually recommend it twice a day, first in the morning after you brush your teeth, and that time you can do about 4 gargles from that half cup of hot water with half teaspoon salt and quarter teaspoon turmeric. And then you can again do it right before you go to bed, so that when you do it in the morning, that protects you throughout the day. And when you do it at night before you go to bed, it again creates a protection for you throughout the night. So those are the 2 times that I usually recommend.
Thank you. And next question is about Goduchi. Number 1, is it available in India? And there's another related question that asks, are the tablets, Goduchi tablets by Himalaya, good?
So Guduchi is a herb that is grown all over India. It's also called as amruta, and it has heart-shaped leaves. So it is easily available all over India. In the Hindi language of India, it is called as Giloi. Now, people usually sell it as powder or capsule. I usually recommend standardized herbal extract, because then that way it gives you certain measured dose of the active constituents. And then I usually don't subscribe to any one particular company, as long as you do your homework and find out the good quality by doing the due diligence. So I recommend standardized herbal extract of Guduchi, or what is known as Giloi in Hindi.
Got it. Thank you for those. And there's another question. Do you recommend Neti practice, Dr. Shanbhag?
Neti is what is known as nasal lavage in this country, or nasal wash. It comes from the yogic tradition, and it is, if done properly, is very helpful for upper respiratory system, specifically for your nasal passages, okay, your sinuses, okay, and also your ear, nose, throat health. So if it is done properly, it's very helpful for preventing allergies, for preventing frequent colds, sinus congestions, and also headaches and migraines related to sinuses and nasal passages.
Awesome. There's so many questions. I hope I can get through all these, but let me ask you a few more, and then I'm going to jump to Paul and give opportunity to other panelists. Dr. Junaid, this question I think is for you. You spoke about prebiotic. Could raw foods help prebiotic?
Yeah, prebiotics are typically raw foods, chicory root, there's inulin. There's a lot of types, but they're typically natural foods that are raw, that are not really digestible by our cells, but more digestible and promote good bacteria.
Does gut microbiome influence mental health conditions like propensity and depression?
Yes, there is a linkage there. The broader term is the brain-gut pathway is altered. So the most amount of serotonin produced in our body, which is a happy chemical that we use, and that's where a common antidepressant medications, the SSRIs, really work, is on serotonin pathways in the brain. The most amount of serotonin that is produced is actually produced in the gut, and that gets absorbed in the bloodstream and influences the brain, as well as melatonin, which regulates sleep as well. So if you have an unhealthy bacterial count that does not adequately convert these natural amino acids like tyrosine into serotonin, then that can predispose you to a lower mood, and depression, and other psychiatric illnesses.
Awesome, thank you. So the next question, if I may, is how do we boost immunity to feeding babies and young children against COVID-19?
I don't think there's any data as of yet what is going to be protective for COVID at this point. The most important thing for kids, for young babies, is mother's milk. The antibodies that are passed through the mother to the child are protective against many different types of bacterial and viral infections. So my suspicion is that that's probably your safest and best bet, is to provide adequate nursing, at least through the first 6 months of life for a baby.
Thank you. And this question is related to ladies. And do we have any remedy for hot flashes related to menopause?
Ayurveda sees hot flashes as aggravation of pitta, or the heat metabolism caused by the hormonal transition that the ladies go through. And there are certain clinically proven herbs like shatavari that are used for this. And also another herb that is used and clinically demonstrated is Ashoka. So those are very helpful. here in the West, there is a nutritional supplement called evening primrose oil that also is used. So some of these are very helpful in that hormonal transition symptom of hot flashes.
The next question is, what is a good diet to follow to improve the brain-gut pathways?
I think certainly some of the things that Dr. Shanbag's team have mentioned are good recipes to adapt to your diet. Really, it comes down to understanding where your microbiome is at now in your life, what insults it has taken, what retained value there is. And so if you're interested in knowing where your microbiome is, do the test. And then using that data, we can create either a diet or other interventions to help improve it.
And there is no one standard good diet for everyone. It has to be individualized or customized for each body type. So the person has to understand what their physiological mind-body type or how their biochemistry is unique, and learn about what diets are good for various body types and then follow those. So there is no one glove fits all.
Got it. Thank you. The next question is, I had to take antibiotics and amoxicillin due to tooth infection. I had diarrhea continuously. My concern is there antibiotic that is easier on the stomach? And if so, what do you suggest?
The antibiotic regimen has to be tailored to the bacterial infection that the individual is suffering from. So, as I mentioned in the talk, antibiotics are really effective killers of all bacteria, both the good and the bad, and that's really the damage that is done when we use antibiotics too much or inappropriately. So certainly use antibiotics when you need them. Try not to get them when you don't need them. And if you are having effects secondary to those that are lasting, then that's something that a microbiome test will help us to determine and treat.
And then after the course of antibiotic, it's important to replenish the bacteria or replace the bacteria by using prebiotics and probiotics that we discussed here, using yogurt or kefir or low salt vegetable pickles, and then kimchi, or even using herbs like onion and mushroom, garlic, banana. Those can help in replenishing them.
I see a couple of people raising their hands. We have a lot of questions in the pipeline. So if you don't mind, and if you could just add your question, I'll get to them as soon as I can. I literally have at least 30, 40 more questions. I can't even count them. There is so much interest in people. We thank you. Let me continue asking questions. So the next question is, can we use dosa, idli, daula, etc. as probiotic foods?
Sure. Dosa, idli, and any fermented is really good. But depending on, once again, I want to go back and find out your body type and then do it. If you are a pitta person and if it is a summer month, both are heat and then outside is heat, then too long fermented food does affect you or bother you, or that might not be recommended. But dosa, idli are a good source of B vitamin as well as good for gut health.
One caution I would provide to people here in the West is that do not buy ready-made dosa batter that has been in the refrigerator of the store for 5-10 days, because that is over fermented and it will increase the acidity and cause you problems with either acid reflux or even gastritis. So freshly made dosa, idli batters are in fact ideal ones. And then as much as possible, don't microwave those before you do your dosa or idlis.
That's very helpful. We don't even think about that. We look for convenience and we miss out on so much in the food that we are eating. Thank you for that. The next question is dairy good for you?
Is dairy good for you? It depends on if you are able to digest that. If you have good lactase, then sure, dairy is not at all bad for you. The best in dairy is still the buttermilk is known as best in dairy, or the ghee. For gut health, buttermilk is the best. So once again, depending on your body type, use the kefir or buttermilk. And for a person who can gain weight easily, dilute it and use it. Use it only during the lunch time, where you will be able to digest it before you go to bed in the evening.
And again,
And
try to go for organic or
A2.
because the dairy industry unfortunately has come far away from natural practices, and as a result, a whole lot of transformation happens the more the process the dairy is.
thank you. So, Gayatri, what's the difference between Kapha person, Pitta person? How do I know who I am?
The best way to find out your body type is by doing the test, or by getting to know by doing a consultation with the Ayurvedic doctor through their pulse, to their tongue. Complete evaluation of that person's body will get to know what your mind body type is, which is Vata, Pitta, Kapha. And then after the mind body type, because of your lifestyle, because of the environment, the stress, and the dietary habit, there could be imbalances, or in Ayurveda we call it Vikruti. So then usually we recommend, that's how you find out your body type as well as your imbalance.
Another shortcut to get a just quick idea is, nowadays there are on internet a simple questionnaires to give you a preliminary idea, but if you have many health problems and symptoms going on, then the questionnaires don't help, and you usually need evaluation, and that evaluation is done in 8 different steps.
Thank you. And how do vegans increase their gut biome?
The food that we eat, it need not be dairy that the microbiome comes from. I think this is the lactobacillus, which is common in dairy, is not the only bacteria out there. It is one of the most common one out there, but that can also be found in other sources. So if you're a vegan, if you're a carnivore, you can still have a good microbiome. There's no one diet that leads to a healthy biome.
So
Thank
with
you.
that, kimchi, which is all vegetarians, vegetables that are fermented, or kombucha, are the good source of vegan, for you to use. And then they can also use now fermented coconut water, which is pure vegan source.
Thank you. And I see that almost 75 to 80% of the people are still online. We are 16 minutes past the time, but the number of people staying on shows the interest. So I'm going to continue asking questions at least for 10 more minutes. So feel free to stay on and wait for your question to be answered. I cannot promise it because there's so many questions. Hopefully we can get to your question very soon. So let me ask the next question. What are mudras? How do they work? And what's the best mudra for lowering blood pressure? I don't know if that is related to gut biome or the topic today, but that's a question I just asked.
That's more of a yoga question. So mudras are using any body parts into a specific position and then creating the focus onto that area. So obviously there are many benefits of mudras, traditionally explained that different mudras reflect on different internal organs and they reciprocate certain response. So there is no specific mention like this mudra helps for this particular ailment, but these are the inferences drawn by practitioners or the logical database over a period of time. So we can't say this mudra is for blood pressure and this is for asthma. It's common, the theme, there are basic mudras like Chin, Chinmay, Adi mudras. So they are like this, which we normally see yogis sitting like this or like this. or like this, and things like that. So using any mudra is actually has the similar impact on your physiology. So it's really
Got
the
it.
calming down and focusing.
Got it. So the next question is, I've been told not to eat raw vegetables as it is supposed to be hard on the digestive system. How do I get my dose of prebiotic then?
In general, you should be eating raw vegetables unless you have a underlying gut disorder. So if you cannot digest raw vegetables, then we have to use supplements that have these prebiotics in there. And my slides, if when we share this, has some of those supplements in there that are good prebiotic sources.
Thank you. And are the resistant starches beneficial to gut microbiome? And if yes, how much time does it take typically for us to see the effect? And what is the recommended dosage?
Variable dosage depending on your need. Some effects are seen within the first dose. We tend to use a proprietary four blend that we call 4Biotic in our practice that we dose at nighttime because it increases production of serotonin and enables better sleep for most patients. Vivid dreams is a side effect that can be seen. In terms of migration of an improvement in microbiome, that can take weeks to months before you see that change on a report.
Thank you. And the next question, is the Indian kanji helpful? How to make, how much to consume?
Indian kanji is very helpful for digestion. If you have a digestion issue, you're not able to digest properly, then kanji during illness, fever or anything, we usually recommend kanji because it's easily digestible. At the same time, it will give you very good nutrients, B vitamins. If you use the whole grain, not the refined grain, then you will get nutrients from kanji. Kanji is basically you cook whether it is rice, whether it is millet, finger millet, which is called as ragi. You can cook it with extra water, and basically you don't waste the extra water that you cooked, and you take that so that you'll be able to digest and get the nutrient faster.
Thank you. And the next question, I always have stuffy nose and constipation. Went through several tests, but nothing came out. I'm looking into Ayurvedic practices now, so looks like I have kapha and vata imbalance. Can microbiome test help me identify the food that is causing these conditions?
I think the microbiome analysis will help us identify the bacteria that are abnormal, and that can help improve the constipation piece. Most microbiome tests are gut-based tests, and we know that the nasal passages have their own microbiome as well. There are no commercially available microbiome tests for our nasal passages. So there are some that are in development right now that we are looking forward to utilizing because that can help people who have chronic nasal issues that are negative on allergy testing and really are requiring antibiotics to manage. So yes, you can do some testing for the stomach, and yes, you can improve that to help improve the constipation.
Thank you.
Kapha and vata, when somebody has both kapha and vata aggravation, it means there is an increase of the cold quality in that person. So they then should be focusing more on having warm foods, sipping warm water, and also using warming culinary herbs like ginger and black pepper in their diet, and that can help both your sinuses as well as your constipation by rebalancing your kapha and vata.
Thank you. And do you do microbiome testing on kids? Is that recommended?
You can do it on kids. If I could take a second, my family went to Bali. My son ate some strawberry shake and had chronic gut issues for weeks and weeks and weeks afterwards, and just wouldn't eat as much. So we actually ended up doing a GI-MAP test on him, and with the right prebiotic probiotic mix, actually restored his gut to health, and everything went back to normal. So absolutely,
Wow.
there's value.
Awesome. So there's a comment and a question. Since eating a whole food plant-based diet, I barely ever get cold, less than once a year. Is 5 colds annually a real average?
What was the question? I didn't quite understand that.
So do people get 5 colds per year on average?
No, that's the typical max that we would want, that we tolerate before we start asking questions. Is there an immunodeficiency present or not? And then there's a slew of tests that are needed to identify that immunodeficiency. So that is a rough north of normal that you should consider as okay, but there's some qualifications. If you're having real severe infections that require antibiotics over and over again, then that certainly also requires some investigation in terms of what is going on with your immune system that is predisposing you to getting infections.
And I'm one of those beneficiaries. I used to get cold multiple times, certainly more than 5 times a year. I changed my diet about 6 years ago, and now I rarely get cold, maybe once, if at all. So, yeah. The next question is, can diabetes be controlled with a diet that supports microbiome and Ayurveda?
Definitely, diabetes can be managed and kept under control with basically 3 factors: is a proper diet for your body type, a very regular exercise, and then using proper food supplements, culinary herbs, and botanical medicines. So with these 3 proper balance of diet, physical activity, and natural medicine, you can keep it under control.
Thank you. And the next question, does ginger lemon warm water drink break intermittent fasting? So let's say in the early morning, they're taking water with ginger and lemon. Does it break intermittent fasting?
Ginger lemon water, since it is very low in calorie, I would not say it will break the intermittent fasting. If you add a ton of sugar to it, or if you add a ton of honey or maple syrup to it, then I would say you have broken the intermittent fasting, because you gave so much of kapha increasing or calorie increasing sugars in there or sweeteners in there. Otherwise, if you're just having a glass of ginger lemon water, that is not breaking intermittent fasting.
Thank you. And the next question is it okay to eat raw vegetables thoroughly washed, particularly as we become old and people with less immunity? Is there any suggestions to eat these veggies for people who are old and have less immunity?
There are cruciferous vegetables which are usually not recommended to be eaten raw. So this is like cauliflower or broccoli. Those for older people who have lesser digestive enzyme secretion and overall their systems are drying, they should go into more cooked and steamed vegetables. If you have leafy vegetables, or if you have other non-cruciferous vegetables that can be digested, specifically those who have a lot of enzymes in them, there is no problem.
And the next question is, are there authoritative websites or books on which we can learn more about my gut microbiome?
Because the field is so new, there isn't one comprehensive place, and the data is changing very quickly. So by the time it gets published, there's already additions and addendums in place. So I could not recommend one particular source that is an authoritative at this point.
Thank you. And next question is for Dr. Junaid. How do we start testing our gut microbiome? And what happens after we send our bowel samples? Do we get analysis by doctors like you? Do we get recommendations of dosage and strains of bacteria, prebiotic or probiotic, that we should take?
Yeah, this is typically ordered by a physician where we have kits in our office, or the companies deliver the kits to the patient's house. We order it. Some of these are covered by insurance, some are not, and they're out of pocket. After you get the report back, it does require interpretation and a treatment plan. And that interpretation is really based on a consultation with your provider, because we need to understand what clinical symptoms we are trying to link with the microbiome. And that will determine what outcomes we're trying to improve.
Got it. And this question is again to you, Dr. Junaid. Do kids born in the Western countries like America to parents of Indian origin have reduced gut microbiome compared to kids born in India?
Yeah, kids born in this country are basically, Indian kids born in this country are equivalent to any other child born in this country, because the parents are effectively eating a diet that is more Americanized. There are higher rates of C-sections in this country as compared to India, plus especially if you start with formula and the other diet that a typical child would get in school will effectively turn their microbiome into an American microbiome.
So is it recommended that we continue to follow Indian diet after moving to America?
Not necessarily, because it depends on how processed your diet is. If you are living the city Indian life in America, then that's basically an effective Western diet. If you are going farm to table, growing your food, eating it fresh, not nuking it in microwaves, all of these things that we tend to do living in a westernized world, that diminishes the value of the food and its impact on the gut.
Awesome. Thank you so much.